at the African Population and Health Research Center. I am going to present my work on social accountability actors and networks and their role in WASH in childcare centers in Nairobi, informal settlements, and youth governance diaries. This is part of Arise Consortium's work. And good to know that there are more women who are working outside home for long hours, and therefore there are mushrooming childcare centers to fill in the vacuum. And when children are in childcare centers, it's always hope or a wish that SDG goal number 6 of access to water and sanitation is achieved. And it's also a wish that SDG goal number 4 of ensuring safe environment in the school setup is achieved. And also that through partnership, the SDG goal number 6 and number 4 could be achieved. And despite that, there are many institutions gaining access to improved WASH. Childcare centers in informal settlements have poor access to WASH. And as you can see in my right, how the WASH services are dilapidated and they're just in poor condition. And we want to understand how existing actors and networks operate in the childcare centers, because you find that WASH is under the Ministry of Water, it's under the Ministry of Health, it's under the Ministry of Education, it's under the Ministry of Social Protection. And so we based our work or embedded in World Bank accountability model and also stakeholder theory. In the World Bank accountability model, there is usually a long route and a short route of accountability. The long route is where you go through the government for the government to provide punitive measures to the service provider. So it's usually long and it does not solve the immediate problems in the childcare centers. And therefore, in most cases, the shorter route of accountability, where the parents and childcare providers or managers work direct, offers most immediate solutions to childcare needs for WASH. And it's usually motivated by the stakeholders theory, which has tenets on authority, interest, and responsibility. The more there are responsibility, interest, and authority, the more the networks become more stronger. And the study was done in 2 informal settlements in Nairobi, and we subdivided into villages or polygons for distribution or for ease during our sampling. And before the data collection, we had community outreaches and also school outreaches, because we were collecting data from both the parents and also at the school setup. And our study design was qualitative in nature and was ethnography, particularly governance diaries. And governance diaries is a basket of methods. And for our case, we had observation of WASH facilities at the childcare centers. We then have reflections to reflect and deep dive into the output that we have. There were also participant diaries that they would write on a daily basis in respect to the actors, networks, interest, authority on a daily basis. And there are also informal discussions. All these informed in-depth interviews that would happen bi-weekly for a period of 4 months. And we had 4 these are the distribution of our study participants. We used a framework analysis, and these were the themes that included actors and networks, roles, authority, and interest. And other than that, from our findings, there were key actors. There were key actors and non-key actors from our findings. The key actors were parents and childcare managers who were providing water directly and mostly on a daily basis. the non-key actors were working through the key actors, or they would be available to provide watch services once in a while. For the networks, there were direct, possible, and desired networks. Most formal actors had direct networks, and those direct networks are the ones that would avail water directly to the childcare centers. But then there were also possible networks or connections that were felt at the community but would not avail water at the childcare centers. But then there were also desired connections or networks that had that were thought to have influence but were not seen more at the community and even at the childcare centers. But then good to note that an actor could have more than one networks depending on the perception of the study participants. And for the role of actors, the role was seen to be based on access, ensuring access, and also promoting quality, as you can see in the photo. And for the authority was based on charisma, that and also it was based on values, such that if you had a charisma or passion and values for ensuring safety of children, believing in children, they would then ensure wash services are availed at the childcare centers. The government, on the other hand, was described to be having a formal and rational influence, which was not mostly, which was thought to not be practical or applicable in many childcare centers in informal settlements. And the interest of actors was ranging from income generation for children to access wash services and for compliance with the government regulations, and from promoting child health and preventing the spread of diseases. We conclude that provision of wash services in childcare centers may be realized when key actors work with networks to demand for services from desired networks. And also, developing more direct networks is very key, and it's also key to convert desired and potential networks into direct networks. And lastly, actors should collaborate to strengthen existing networks that enhance wash services. And thank you to the funders, GCRF, UKRI, and also to the RISE Consortium, the study team, and my supervisors, Professor Penny, Phillips Howard, Professor Helen Elsie, and Professor Blessing. And thank you. For any question, feel free to share or send to my Gmail, ivichumo@gmail.com. Thanks, and if you have any question, thanks so much. For now, that's just it. But I will